Hi, Facebook family. Happy Friday. My name is Dr. Shayla Toombs-Withers. I am the physician owner of Essence of Health Wellness Clinic. So today's topic is about prevention and preventative care. Um, One of my favorite quotes is an ounce of prevention is worth a pound of cure. And so, what does that mean? Well, that means is that if we can prevent ourselves from developing a certain illness or disease, then that will be much more worthwhile to us, even versus trying to actually find a cure for that disease or find a treatment or a medication to treat that disease. So today we're going to talk about prevention. Particularly, we're going to talk about what's recommended at certain ages of life in terms of prevention. So, a lot of times I'll have patients say, "Well, I'm healthy, so why do I, need to see a doctor? I don't really need to see a doctor unless I get sick." But I tell people, you really want to come see me, you want to come see us before you actually get sick, so that we can help to prevent you from getting these chronic diseases and these chronic illnesses. So that's why you should see your doctor. You should at least see your doctor once a year, and more frequently if you already have a certain disease. So let's get started. So a lot of people know about children, and a lot of people will take their babies and their children to see their doctor regularly because, as we know, once those little babies come out, they do have to be seen by their doctor every few months. And the reason for that is so that we can monitor their development and so that we can make sure they aren't at risk of developing certain childhood things. So prevention is important from a childhood perspective, but it's also important from an adult perspective. And so we usually see these babies, like I said, every couple of months up until they're about a year old, and then that gets spaced out a little bit more until they're over the age of 2, and then it becomes more of a yearly routine. A lot of people do drop off once they hit the teenage years because a lot of teenagers are usually healthier. They don't really get sick, and so people forget to take them in too for their yearly physical with their doctor. So in the teenage years, it's also important in terms of prevention. That's when we can start monitoring things like blood pressure in those teenagers to see if they're at risk of developing hypertension. We can monitor things like their cholesterol, if there's a family history of cardiovascular disease or a family history of where somebody may have died of a heart attack at a young age, then we can start to look for those things earlier. So in teens, STD, sexually transmitted disease prevention, is also a part of that. So it's important to also bring your teenagers in for their yearly physicals. And then once we reach adulthood, there's certain guidelines that we follow. So the guidelines I'm going to chat with you today are from the United States Preventative Services Task Force. So that's a lot. They go by the acronym USPSTF. And so what this task force does is they look at our American population and things that are most likely to cause harm to us. And they look at the scientific evidence in terms of at what age we should be screened for these things to get the most benefit out of prevention. And so there are certain things that are just kind of common for anybody over the age of 18. And so that's screening for like alcohol abuse, smoking, high blood pressure, depression, and mental health issues. So those are more common ones that most people know about. HIV screening is one I find that a lot of people don't know, but it is actually recommended that anyone over the age of 15, so ages 15 to 65, should have a HIV screening. And that's regardless of lifestyle, sex, regardless of anything. Everybody between 15 and 65 should at least have a HIV screening. Other screenings that are important as we age, pap smears. So, a lot of people remember the old recommendations where people, as soon as you became sexually active or you became 18, people were getting pap smears. So that has changed. The newer recommendations for pap smears is that pap smears begin at age 21. And then the recommended rate of screening is every 3 years. And that's if the pap smears are normal. If you've had some abnormal pap smears, then you want to discuss that with your doctor to determine what exactly your routine on getting a pap smear should be. Pap smears do screen for cervical cancer, so that is the importance behind this screening. But every 3 years over the age of 21, and then at the age of 30, if they do something that's called a co-test, which looks for human papillomavirus or HPV, that's actually the virus that puts you at increased risk of cervical cancer, then if that test is performed along with the pap smear and both of those come back normal or negative, then you can actually push that pap smear screening out to every 5 years. That's for women over the age of 30. So those are the pap smear and cervical cancer screening recommendations. Now, in terms of diabetes screening, so at the United States Preventative Service Task Force actually recommends screening at age 35 for that, and that is in individuals who may be overweight or obese. However, that is another one where I'll say, if you have a strong family history of diabetes, then you probably should be screened earlier because we are seeing more and more diabetes even in our teenagers and our 20-somethings age group. So that is another reason that you really should talk to your doctor and have that routine checkup year to year. Another screening that a lot of people may have heard about is Hep C screening. So that's one that came out just a few years ago that we are screening individuals who were born between the birth years of 1945 and 1965. Those folks should be screened for hepatitis C. And the reason behind that is because they found that there were a lot of undiagnosed cases, and hepatitis C can lead to liver cancer. And so that's another screening that's important. Some of our more common ones, colon cancer and breast cancer. So colon cancer, the recommended screening test for that is a colonoscopy. Now, in terms of the age at which you should be screened, that one you'll find is actually variable, depending on the group that you're following. So since we're discussing the United States Preventative Services Task Force, they recommend that screening begin at age 50. Now, I will say there's a caveat to that. If there's a family history of colon cancer, then you probably should be screened earlier. And so that's another reason to talk with your doctor about your risk. And the American Cancer Society actually recommends screening at age 45. And there are some other groups that are more aligned with the age 45 screening, especially in higher risk populations like in African American communities. So that's another one that you would want to discuss with your doctor. Breast cancer screening is also one that's variable. So around 2016, the recommendations changed, and there's been this big split in terms of who recommends what. So the United States Preventive Services Task Force actually recommend screening at age 50 to 74, and they recommend every 2-year screening, and that would be with mammogram. Now, if you look at American Cancer Society and some of the other scientific groups that are out there, they still keep that recommendation at age 40 to 45, with screening being performed every 1 to 2 years. And then that's another one where I tell women, depending on your risk factors, if there's been someone in your family who had breast cancer, especially if that was a first-degree relative, so if that was your mom or your sister, then you may need to get screened sooner, and that's something you do want to take a look at with your doctor. There are some risk tools that we can use to determine when's going to be the best time for you to start getting screened for that. And then the other screening I want to talk about is lung cancer screening. So smoking had become a really common thing here in America. And so what we have found is that more people were suffering from lung cancer. And so now there's a recommendation at age 55, so looking at 55 to 80-year-olds, if you've had a 30-pack year history of smoking over time, or even if you've quit smoking, but you smoked that heavily within the past 15 years, then it is recommended that you be screened for lung cancer. And that screening would be a chest chest CT scan with low dose chest CT that can be ordered by your doctor and performed to see if you have any pulmonary nodules or anything that they see on your lungs that is showing that you have an increased risk of lung cancer. And then there's osteoporosis. So this one is recommended by the United States Preventative Services Test for starting at age 65. And what's the screening tool used for that is a DEXA scan or bone density scan, which is pretty much like an x-ray, but they look to see the density of your bones to determine your fracture risk. Of course, if you are higher risk for that, and that usually includes Caucasian women who are lighter in weight, so frailty is also a higher risk factor, so you may need to be screened sooner. And so that's something you would also want to discuss with your doctor. So this is just not an all-inclusive list, but just to show you the reason that prevention is so important, and the reason that you should see your doctor routinely to know for your age group, because we look at this age to age and can be able to tell you what you may be at risk for and what screenings you may be due for to keep you healthy. Now, I've got a question here that I'm going to address from Hannah Montana. Thank you for joining me. How often should I get a full checkup annually? Yes, so you certainly want to get a full checkup at least once a year because, as we discussed, as you age, those recommendations change. So things that may have been recommended for you when you were 20 or 30, those recommendations will change as you age to become 40 or 45 even. So yes, you do want to see your doctor annually. And then for those other basic screenings like your diabetes screening and like your blood pressure screening, those things can change year to year. And so it's certainly not a bad idea to see your doctor at least once a year, get a panel of blood work, and get those recommended screenings for your age and for your risk factors, which will take into account your family history also. Another question here, what are the expected out-of-pocket costs for some of these tests and screenings? That's a great question. And so in terms of that question, when the Affordable Care Act was passed several years ago, one of the things that they wanted to include was a lot of these preventative health screenings. And what they did was make it to where health insurance should cover the costs of many of these screenings. Now, I say should because there has now become some different caveats and different complexities when it comes to the cost of these screening tests. Mammograms and pap smears for most folks are usually covered. Colon cancer screenings have become a little bit of a gray area from a standpoint of if it's truly just a screening and it's normal, meaning they don't find anything, they don't have to take any polyps off, then usually that's covered by most insurances. And that can depend, though, still with what your particular plan look like and if you have a certain premium or deductible that you have to meet. Now, the other side to colon cancer screenings, though, is if they do have to remove a polyp and they have to send that off for biopsy, then that puts you in a different category for the colon cancer screening, and sometimes they'll consider that more as a diagnostic instead of a preventative because they actually do have to look and see if they have to diagnose you with something because they found this abnormality. And in that case, that may not always be covered completely under the preventative care part of the insurance plan, and sometimes you may get a different bill for that. There are, though, several other ways of screening for colon cancer nowadays. So if people are concerned that they may not be able to afford actually a colonoscopy, there are several other screening tests that can be done. There's a Cologuard test, there's a FIT test, and so there are other things that can be done that can be significantly cheaper. Colonoscopy is still the gold standard, but there are other ways to still get people screened. In terms of mammograms, there are several programs in a lot of cities and in a lot of states where they will offer free screening mammograms for people. Some of these are mobile places, especially here in Chattanooga. We do have a mobile service where people are able to get free mammogram screenings. And so that's another thing that you can discuss with your doctor or contact your local health department, and they can certainly help you in terms of determining costs of what these things could be out of pocket for you. In terms of preventative lab work, that can be variable. A lot of that is going to depend on the cost of your insurance plan. Do they cover the preventative labs? Do you have to meet your deductible first, or what does that look like? One of the benefits for Essence of Health Wellness Clinic patients is that they're actually able to take advantage of a significant discount on their lab work, and that's regardless of insurance or not having insurance. And so a lot of the routine lab studies here at Essence of Health can run as cheaply as about $3 to $5 for just your routine labs. And so that's one of the things that members are able to take advantage of here in the clinic. Do I have any other questions from folks out there? I really appreciate you all joining me today. So I will still accept questions, and I am happy to answer questions within the comment sections of this video. I do thank you all for joining me. I would also like for you to take a look at my Instagram page. It's also Essence of Health Wellness Clinic. I am accepting new patients. You can give me a call at 423-225-2245 to schedule a free 15-minute meet and greet and learn more about the practice. You can also take a look online at www.essenceofhealthwellnessclinic.com. It's not too late to take advantage of free enrollment up to the end of this month of February. So thank you for joining me. Remember, the essence of health is in you. Take care.